Welcome to Aurora's COVID-19 Awareness Training. Course Objectives. After completing this course, you should understand the following. The steps Aurora is taking to protect workers, your responsibilities of preventing the spread of COVID-19 in the workplace, best practices for social distancing, proper hand washing techniques, the best practices for sanitizing your work area, the different types of personal protective equipment, PPE, in the workplace and their use. At the end of this course, you will be given a quiz to verify your understanding of the training. A passing score of 80% is required. What you need to know: how COVID is spread. Particles containing the COVID-19 virus can travel through the air more than 6 feet when an infected person talks or vocalizes, sneezes, coughs, or exhales. COVID-19 may be transmitted when a person touches a contaminated object and then touches their eyes, nose, or mouth, although that is less common. An infectious person may have no symptoms. What you need to know: hand washing and social distancing. Frequent hand washing is important to stop the spread of germs. Follow the 5 steps of hand washing. Wet your hands with clean, running water and apply soap. Lather your hands by rubbing them together with the soap. Scrub your hands for at least 20 seconds. Rinse hands while under running water and dry hands using a clean towel or air dry them. Protect yourself and others by practicing social distancing, keeping 6 feet from other people. What you need to know: voluntary wearing of masks. At Aurora, the wearing of masks is voluntary unless there is an outbreak, and the wearing of masks is required by the Department of Public Health. An effective mask, when properly worn, like an N95, KN95 and KF94, offers the best fit and filtration. At Aurora, any coworker is allowed to wear a mask unless the wearing of the mask creates a safety hazard. What you need to know: wearing an N95 respirator on a voluntary basis. Wearing of masks or respirators is not required. However, if you choose to wear an N95 respirator, you must read, understand, and sign Appendix D of the Respirator Standard. Appendix D outlines what you need to do to safely wear a respirator. It is important that you know how to use, maintain, clean, and care for the N95 respirator. Most importantly, you must know the respirator's limitations and what contaminant the respirator is designed to provide protection. If you choose to wear a N95 respirator, you will need to review the YouTube video on the voluntary use of a respirator. See link provided. What you need to know: proper use of masks. It is important that you properly wear your mask. Make sure your mask completely covers your nose, mouth, and chin. Check for gaps between your face and your mask. Check the edges of your mask for air leaks and adjust, if necessary. Adjust the ties, bands, or ear loops to improve the fit of your mask, and adjust the nose piece. A well-fitting mask should be large enough to completely and comfortably cover the nose, mouth, and chin without gaps. Not allow air to escape from edges. Fit securely to the head with ties, bands, or ear loops. Be comfortable and not require frequent adjustments. When choosing a mask, the fit is important. Keep in mind, the fit of the mask can vary depending on the size and features of your face. Masks with a flexible nosepiece may provide a better fit over the nose. If choosing an ear loop style mask, use one with adjustable ear loops. What you need to know: use of hand sanitizers. Use hand sanitizer when you can't use soap and water. Washing hands with soap and water is the best way to get rid of germs in most situations. Use alcohol based with 60 to 95% alcohol. Put enough sanitizer on your hands to cover all surfaces. Rub your together until they feel dry. Do not rinse or wipe off the hand sanitizer before it is dry. Sanitizers can quickly reduce the number of germs on hands in many situations. However, sanitizer do not get rid of all types of germs and may not be effective when hands are visibly dirty or greasy. Hand sanitizer may not remove harmful chemicals from the hands such as pesticides and heavy metals. What you need to know: sanitizing the workplace. Regularly cleaning high-touch surfaces in the workplace helps to prevent the spread of germs that make people sick. Aurora provides hand sanitizers, and cleaning and disinfecting wipes, sprays, and towels. High touch points such as doorknobs, Desks, telephone, keyboards, mice, chair backs, and arms should be cleaned. Visibly dirty surfaces should be cleaned with soapy water and then with disinfectant. Always read the instructions for EPA-approved disinfectants to ensure proper and safe use. You should read the safety data sheets for the disinfecting chemicals, wipes, and sprays provided. What you need to know: additional steps taken at Aurora. Period inspections are conducted at the workplace to ensure that safeguards are being maintained. The inspections include a review of physical distancing, ensuring the availability of face masks, hand sanitizers, cleaning and disinfection schedule, coworker training and communication, and other health and well-being measure taken. You and/or your representative are encouraged to participate in the identification and evaluation of COVID-19 hazards. Just let your supervisor or manager know that you wish to participate in these inspections. What you need to know: COVID-19 symptoms and reporting. It is important that you know the symptoms of COVID-19, which include the following: cough, shortness of breath, or difficulty breathing, congestion, sore throat, fever or chills, fatigue, headache, or body aches, nausea, vomiting or diarrhea, or new loss of taste or smell. You must continue to self-screen, stay at home if sick, and report positive cases or exposures to positive cases to your supervisor or manager. You also must report positive cases and exposures to positive cases through the Qualtrics Health Screening Survey. Testing for coworkers who have had a workplace close contact. COVID-19 testing will be provided, at no cost, during paid time to team members who have had a work-related exposure or during an outbreak. What you need to know: ventilation, an effective measure to reduce the spread. Where possible, the following measures have been taken to reduce the risk of exposure to COVID-19 by improving air quality. The use of portable fans to increase the effectiveness of open windows or doors, the use of portable fans with HEPA filtration, and the optimizing of mechanical ventilation, HVAC, by opening air dampers beyond minimum setting to reduce or eliminated air recirculation to increase the introduction of outdoor air. Benefits: if you cannot work due to COVID-19 illness. If you are ill due to a COVID-19 illness, contact your human resources business partner to determine what benefits may be available to you. In summary, stay at home when you have suspected or confirmed COVID-19 illness. Remain vigilant by continuing to follow national and local guidance on COVID-related protocols to keep you and your family safe. Get your COVID-19 vaccine and stay current with the boosters. A copy of the Aurora Packaging Solution COVID-19 plan is available on the Aurora Safety intranet page. If you are worried that you may have COVID-19 or have been exposed, get tested and isolate until you receive a negative test. If you have any questions or concerns, ask your supervisor and/or regional EHS manager for help. Thank you.